what I want to demonstrate right now is I want to demonstrate what a follicular unit extraction is. Basically, we want to be able to isolate that follicle, the follicular unit. The follicular unit comes out in little bundles. So this is a little bundle here, that's a little bundle there, that's a little bundle there, and so forth. So what the doctor has to do is they have to isolate that bundle. Okay, so let's pick a little bundle right here, and they're going to take that little bundle out with the follicular unit, basically do a little punch, okay? Just like that, okay? So the patient's obviously not feeling anything because he's all anesthetized, and we take that out, okay? So now we're going to take this little bundle. Now, okay, so that's what we did. So now let's take a look at it. What's happened now on this particular one is the bulb of the follicle has been transected. So we tried to punch that one hair out, and look at where's the bulb? It's non-existent. We cut the bulb off. Okay, so this is part of the general process of what patients go through is they lose hair. Hair changes angles, hair changes directions, hair changes all over the place. So to try to pull out this blindly, okay, now that one just pulled the whole thing out. So now it's in my instrument, right? I didn't do anything different. Now the follicular unit's now in my instrument. I pulled it out. Okay, now look it. This is what happens. We pulled it out. We have the bulb down here of one. We've now transected this other follicle, okay? So my first shot, okay, all transection. Second shot, let's take a look at that. Bulb transection. So there's two shots. Let's go again, okay? Now look it. We put these little holes in the patient's head, okay? This is with a 1.5 millimeter punch. Most doctors use a smaller one than this. So there's much more room for error with the smaller instrument. So now let's try another graft. Say, look at this little guy. Here's a nice big one. Let's try to get this guy right here. Okay. So here it is in its environment. We're just trying to take that little guy out without destroying the follicle. Okay, so we pulled that out. Now let's take a look at this one. Okay, so now we pulled this one out. Okay, now we got a follicular unit. So we got a bulb down there, another bulb there, little transection. Okay, this would be considered a great follicular unit graft, believe it or not. Okay, that's called that would be considered a good one. So now I tried to pull 3 follicular units out. I got 1 hair here, no hairs there, and 3 hairs there. And how long did that just take? Okay, I just spent 5 minutes trying to do that. Here are my grafts that we just harvested right now, and these are my 1 hair grafts, the micrograft. The dot is the bulb of the follicle. That's the follicle itself. This is a follicular unit down here, the second row. Follicular unit is that naturally occurring bundle of hairs which might have 2 or 3 hairs. If you look here, you can see those 2 dots. Okay, 2 dots, 2 hairs, 2 dots. This one, you can see the 3 little dots, which means it's a 3-hair follicular unit. So what the doctors who do follicular unit extraction are telling you they're going to do is they're going to pull that follicular unit graft out without transecting it. So it's just going to perfectly go without cutting it. Well, here's what happened when I did it. Okay, I transected those follicles, and this is what my grafts look like. So you're going to get more of a chance of having transected follicles when you do a follicular unit extraction case. There's more of a chance of having a lower yield with less of an outcome. So what I do differently than everybody else is I use that multiple follicular unit graft where I'll have 2 or 3 of those follicular units in that one graft. So now you can see all these little dots. 1, 2, 3, 4. Turn it upside down. 5, 6, 7, 8. That has 8 hairs in that one little slick graft. Okay, so if you were to look at this little fellow from the top, you can see those little bundles. 3 bundles in there, and those each have 2 to 3 hairs. And that's how we get that amount of hair we do, is by using this specialty graft, which we call here the Bolton bundle, which is a multiple follicular unit graft.